All right. We will go ahead and get started. So I'm going to put a link in the chat. This is for the sign-in sheet. We'll also send this out via email after the session today. But just as a reminder, please do sign in for today's meeting so that we can track it for VBR. But like I say, that'll be included in the email that you'll get after the session today, which will include these slides as well. So first of all, thank you for joining. This is our October Learning Community event focusing on the patient data dashboards for MCT2D. This will be co-led by myself. My name is Jake Reese. I'm the Associate Program Manager for MCT2D. And Laria Young, who is our Design and Informatics Project Manager. And so we'll be co-leading this discussion. We also have Dr. Joyce Lee on the call here, who is our one of our clinical content experts focusing on data and informatics, who will be here to answer any questions related to data and informatics around type 2 diabetes. So without further ado, we can go ahead and jump right in. And if you do have any questions, please do put those in the chat, and we'll be monitoring that as we go, and we'll address those. All right. So first things first, this is approved for learning community for CME for the live session attendance. So assuming that you're here live with us today, you can get CME for that by following these instructions, just like the other events that we've hosted in the past. And then disclosures, just that our program director, Dr. Lauren Oshman, has stocks in publicly traded companies, including Abbott, Johnson & Johnson, Lilly, Merck, and Organon. So our agenda for today, we're going to start out talking a little bit about the data sources that are both integrated into the dashboard as it stands currently, as well as some of the data sources that we'll be working on implementing throughout 2025. We'll look at the patient identification tool, which is a combination of two features, what we call the patient list and the patient profile. We'll be talking about some of its current features, as well as some of the revisions that will be being made to it over the next 2 years or so. We'll talk about what those revisions are and how they fit into what the larger project is of Dashboard 2.0. These slides will be available. Yes, Brenda. They'll be sent out after the meeting. And no worries about not having a camera. For Dashboard 2.0, we'll talk about a little bit about what has already launched as far as the summary measures page, as well as the additional new features and functions that will be coming out over the next year or so. We'll talk about some of the data quality work that's going on, and we'll continue to go on to try to improve the availability and completeness of some of the data. And then we'll talk about, if you do not have access to the patient data dashboards at this point, how you go about doing that. All right, so diving right in here, starting with data sources, we want to talk a little bit about how the data flows, how we're actually getting the data. And this is obviously a very complicated diagram. The slide after this has a pared down version of this. And so if this looks too busy, no worries, it is busy. So the overarching idea here is that data from participating physician organizations, hospitals, device vendors, and other originators of data is flowing into this central entity called the Michigan Health Information Network, which is a combo public-private entity that works with the state of Michigan, the Michigan Department of Health and Human Services, as the state vendor for health information exchange. The data that is aggregated within MyHIN includes claims data, as well as EMR data in the form of what we call PPQC, or Physician Payer Quality Collaborative data, as well as SDOH data, social determinants of health data, and other lab and specific use case data that comes from various vendors. That data is aggregated and assigned master patient IDs within MyHIN and broken down to the patient level. And then that data is available to the CQI Data Hub, which is housed here at the University of Michigan through the Michigan Data Collaborative. And that data is then able to be built out into the patient data dashboards and quality reporting dashboards that you see both for MCT2D as well as for your other population CQIs, such as Inhale or other CQIs in the future, MyMind or things like that. So that data then is able to be built out into these dashboards, which obviously MCT2D kind of dictates the way that data visualization is completed. And then obviously we have folks like Laria who take the feedback that we receive from you guys to really integrate that feedback into the usability of the dashboards to make sure that what we're providing to you as the end user is of highest value. So with that, we're going to go to this a little bit more pared down version of that kind of summarizes what I just said here. So the data is flowing from practices or really the physician organizations as the data submitter to the Michigan Health Information Network into MyHIN and then back to the CQIs to be able to be used for quality improvement purposes. So as far as current data sources, so the top section of this slide is what we've been telling you since the CQI originated. The bottom section of this slide represents a huge juxtaposition and increase in the available data that launched just this week. And so that's what we're going to spend a little bit of time talking about. So up until prior to this week, our data sources included claims from Blue Cross Blue Shield, BCBSM MA, Blue Care Network, and BCNA. That data was from 2018 through obviously current being June 30th of this year. And we also had claims data. That clinical data, included labs, biometrics, and other patient-specific information that was coming directly from the EMRs through MyHIN, through that flow that we just talked about. That data was also obviously current through June, but only went back to 2020. A couple of points of clarification. The data that we have is limited to adults over 18 years of age, and we did exclude any outlier values over 20 for A1C, for example, but outside of that, the data that we received is not manipulated whatsoever. So the big juxtaposition here is that in this week's recent data enhancement, we did integrate what is called the Active Care Relationship Service, or ACRES. ACRES is a model that physician organizations are able to say that this patient is attributed to a provider within my organization. That allows us to incorporate data that is not specific to Blue Cross Blue Shield or BCN, because prior to that, the attribution model that was being used that we had access to was the Blue Care Network Provider Attribution Network. So that only included patient attribution for those patients with either Blue Cross Blue Shield or BCN insurance or their respective MA plans. This juxtaposition to ACRES attribution doesn't replace that model. It is to supplement that model. It had brought in an additional 56,944 patients that we did not otherwise have access to through that BCN attribution file. So a good chunk of those patients are going to be non-BCBSM or BCN patients, because those patients were previously brought in via that BCN model. There will be some patients in that 56,000 that still have Blue Cross that weren't identified for one reason or another, that are captured now via ACRES. However, this does now open the door to what we have called all-payer PPQC data, or all-payer clinical data. So this is our first step in that direction, which is very exciting and will continue to grow and improve over time. So just as a quick reminder here, the eligible patients for the MCT2D dashboards include any patient, obviously, with a diagnosis of type 2 diabetes through an E11 code, or an A1C greater than or equal to 6.5 in the clinical data, or greater than or equal to 7 in the claims data, because that's the way that it's broken down in claims, or a diabetes medication filled within the last 6 months. Importantly, this includes an exclusion of any patient with type 2 diabetes. Obviously, this is focused on type 2 diabetes, and so we don't want anybody with type 1 coming through there. The other couple of points of clarification here is that we have eliminated any GLP-1 receptor agonists that are used strictly for weight loss from this medication definition. So a patient, for example, that's on Wegovy won't be included in this data set simply due to the medication criteria, unless they have one of the other two claim criteria here. All right. So from future data sources, like I mentioned, the all-payer PPQC data attribution through the ACRES system was completed this week. So that's really exciting. And that will continue to expand as better patient matching improves. We also have a slate of new data sources planned for 2025, including Michigan Medicaid claims, which is slated for Q2 of next year. SDOH data, which is slated for Q3 of next year, and Fire Bundle data, which is a separate set of clinical data that will kind of supplement the current clinical data that we have, which really focuses on inpatient hospitalizations and that type of data set that will be incorporated in Q4 of next year. I see a question in the chat here. Carrie Nicholson says, yes, I placed a couple of people on metformin given early for long COVID. Yeah, so that's a good question. So in the way that the data is currently set up right now, yes, a patient that is on metformin for something other than type 2 diabetes, either this COVID indication or, for example, for PCOS or something like that, they would trickle into the database, potentially not as we would hope that they would. However, we're trying to address as large of a logic as possible. So those patients may inappropriately end up in the data set, but we're trying to make sure that we cast as broad a net as possible and eliminate as many outliers as possible. So that's something that we're considering and continuing to try to improve upon the specific outlier cases. What about patients that are prescribed an SGLT2 inhibitor for kidney function that don't necessarily have type 2 diabetes? And exactly to your point, the metformin use case is outside of type 2. So that's something that we continue to work on. As of right now, those patients could trickle in, but we'll try to figure out how that we do some exclusions for them in the future. Great question. So this is our refresh and release schedule for 2025. Or I'm sorry, for the remainder of 2024, excuse me. And so you can see here in green, those are the ones that we've already completed for this year. You can see that we have enhancement release 3 planned for, it was planned originally for next week. We actually got that pushed out a little early. So that was the release that included the acres attribution that opened the door for that all payer PPQC data to be implemented. So that's very exciting. We're going to be canceling our November data refresh because we're putting all of our eggs into our enhancement 4 release schedule, which is going to go out on just before the end of the year in December. And so that will include additional visualizations associated with the A1C PCP VBR measure. So for those of you that are familiar and are primary care providers, the MCT2D performance measure this year is focusing on A1C control for patients with commercial and Medicare insurances, and we'll have a dedicated adaptive population-based visualization on the patient data dashboards that will represent your progress on that. All right. So we're going to move now into the patient identification tool. We'll talk a little bit about our current state, and then at the end, we'll talk about the additional features and functions that are going to be coming down the pipeline. And then Laurie will take it away and talk about how this is going to look completely different in a couple, probably in about 6 months or so as we move more towards this updated dashboard 2.0 state. So a couple of things I want to call out here, first of all, is that this is from a demo environment. This is not real PHI, so no worries there. This is what we call the patient list. And you can see in the top left-hand corner of this slide, I have the red box around patient list. Those tabs function very similar to how a Google Chrome tab functions. This allows you to toggle between the different features and functions of the dashboard. The idea of the patient list is really to allow you to search for patients of clinical interest to you based off of the quality improvement work you're hoping to do. So we know that there is some of this functionality available in some EMRs, such as Crystal reports within Epic, for example. But for those EMR systems that either don't have this ability to do some of this filtering, or that filtering is more difficult to achieve and you have to go through your IT department to get that set up, this is something that we have provided to you to be able to utilize for those types of diabetes-specific QI initiatives. So across the top on that patient list, you'll see a number of the different columns. There is a scroll bar at the bottom that is a horizontal scroll. Along the right-hand side here, this bulleted list are all of the different column categories that there are. And so you can actually sort this patient list by clicking on that header, and it'll sort it either from ascending to descending or descending to ascending with whatever the value is that you're sorting. You can also utilize, and the main feature of this is the filters on our left-hand pane here, and that's what we're going to move into talking about now. So on that top button right next to the word filters, if you click on it, if it's not expanded, it'll say more. So if you click on the button that says more, and you can see that in our previous slide here, that button will then change to say less, but this is how you open up the secondary filters panel. And I have called out a number of different filters here just so that you can see what they look like on the drop down. So as you can see on the patient list tab here, we have a great number of different possible filters, and these are adaptive based off of what you've selected before. And so, for example, you can add filters to each other. So you can search for a patient that has an A1C greater than 8, who is not on a GLP-1 receptor agonist, who is on insulin, and has gained at least 5% of their body weight in the last 12 months, and then run that report. And that could be a great opportunity to find patients who may be a good candidate to get onto a GLP and potentially off of insulin, since they aren't currently on a GLP and are gaining weight on insulin and still have an uncontrolled A1C. That's just one possibility for this, or as to how it could be used. So provider type, I want to call that out here. So you can search or narrow this list to patients that are attributed to specific provider types. And so, for example, if you want to find only patients that are attributed to a nephrologist within your practice or within your physician organization, depending on your access level, you could do that. We are in the process of integrating endocrinologists into this. That'll launch in Q1 of 2025, and you'll see that again on a slide in a little bit here. Under practice, you'll be able to select the various practices that you would like to see patients from if you are a PO level user. So if you have access to multiple practices, or if you're a provider that works at different practices, you'll have access to be able to select between those two or to view them all at the same time. So some of the medication drop downs here. So you can see GLP called out here. So there is a distinction between clinically recommended and not clinically recommended here. You can filter for both at the same time or just have one selected. That not clinically recommended is referring to some of the GLPs that do not have the same cardiorenal protective benefit as some of the newer GLPs do. So for example, Bydureon would be considered not clinically recommended versus Trulicity or Victoza would be clinically recommended due to the cardiorenal protective benefits that they come with. So pharmacy coverage, this is another one that can be kind of tricky. What this is referring to is pharmacy carve-outs. Pharmacy carve-outs, for those that don't know, are when a patient has pharmacy coverage through an insurance provider separate from their health insurance. The example that I always give is that as a University of Michigan employee, I have Blue Cross Blue Shield insurance. However, my pharmacy coverage is actually through Magellan. So I have a Blue Cross card for my health insurance, but I also have a Magellan card for my pharmacy coverage. And that allows you to select for those patients that have pharmacy coverage directly through their medical insurance. And the reason that that's relevant is because if a patient does have a carve out, meaning that they have a different insurance provider for pharmacy, we will not have claims data for that patient because claims is through Blue Cross Blue Shield right now. We're working on possibilities to get claims from different insurance providers or potentially from pharmacy benefit managers such as Magellan in my case. However, that's not a feature that currently exists. There's a question in the chat from Carrie Peterson about how often the patient lists are updated. That's a great question. So the data is refreshed every 6 weeks. And so the data lagged right now runs between about 2 to 3 months just because of that flow that we talked about at the very beginning and the time that it takes for that data to make it all the way through that flow, be validated and refreshed. But it is refreshed every 6 weeks or so. At every 6 weeks interval, we'll be back up to that 2 to 3 month lag. And then again, that lag will increase by those 6 weeks until the next refresh. All right. Along the right-hand side here, we can see a couple of other examples of some of the filters that are available. You can see statin status there, as well as ACE-ARBs, other diabetes meds. Obviously, we didn't have quite the space to list every single class of diabetes medications, and some of them get a little in the weeds for the purposes of the QI initiative. So if you want to find if they're on a different med that's not specifically called out, that's how you would do so. Question in the chat here, I struggled to find the patient list. So this is through the patient data dashboards, Brenda. And you can see here the tab at the top, after you sign the attestation, just clicking that you agree to the proper use of the PHI, you'll automatically be taken over in the patient list. If you have specific access issues, let me know and we can do a one-on-one session or I can help get you access. And then as far as the retinopathy screen feature, this is just to differentiate whether or not a patient has had a documented retinopathy screen through the claims within the last 12 months. So this is something that can be useful for making sure the patients are receiving their preventative maintenance care. All right, so this is just a quick little GIF about how the actual features and functions of this dashboard look in real time. So I'll just let this play for about 10 seconds here. You can see that in this GIF, they added a few different filters and that patient list filtered down from 1,200 patients to 105 patients. That allowed them to find a much more narrow list. They were able to click on a patient, look at that patient's details in a little bit more detailed way, and then potentially go back to their medical record system, their EMR, to look at that patient's full record. All right. So the next tab here, you'll see right next to patient list is renal details. At first glance, it appears identical. It is almost identical. The idea here is that this is more specific to, as it mentions, renal details. So this is going to focus on kidney care associated with patients with type 2 diabetes. Now, as we move more into this revised version of the dashboard that we're calling Dashboard 2.0, as the patient list features go under review and under design, we will be integrating both what is currently called the patient list, really the type 2 focus side of this, and the renal detail side of this into a cohesive combined feature. There just wasn't enough room as the way Tableau is currently designed to allow for all of these different filters to fit all on one page. And so that will be changing within the next year or so. But as of right now, renal details is its own standalone tab. Along the top here, you'll see that there's a considerably less number of columns. It is pared down just a little bit. So you have just those 6 columns there, but you can also still sort those just as you can on the patient list tab. We have a number of the same filters, but we also have a couple of new filters. So for example, you can see the practice provider type 2 diagnosis are all still there. A1C, BMI, blood pressure are all still there. Even some of the diabetes meds, GLPs, SGLT2s are still there. Statins was on patient list as well, and it's still here on the nephrology side as well. The couple of new filters that we do see here are the chronic kidney disease diagnosis. So you can filter by that diagnosis status. You can also filter by whether or not the patient is under the care of a nephrologist. So for example, you could search by patients that have a CKD diagnosis but don't have a nephrologist. That would be relevant to the searches. And then also we have a couple of kidney-specific lab filters here, both for albumin-creatinine ratio and for eGFR. And for those filters, you can search both by whether or not those values have been taken within the last 12 months or as current, as this is currently defined, as well as what the values for those 2 labs are. Question in the chat, where is the download button? Great question. So I don't have a screenshot of this, I apologize, but in the bottom right-hand corner, there is a box with an arrow pointing down, and you can download using that. It is not the most user-friendly download button. That is something that will absolutely be improved upon within Dashboard 2.0, and I'll let Laria speak a little bit more about that when she gets to that. But there is a download function, and that's something that we can definitely get more into if you do want to do a one-on-one session, which I will say, if anybody wants to do that, I absolutely love meeting with folks and doing training sessions. So please feel free to reach out if you'd like to do that. All right, so moving over to the patient profile here. So just to kind of level set, this is not meant to replace your EMR system at all. This is meant to supplement it. This is meant to give you a quick snapshot view of a patient who you may be interested in providing either additional care for or making adjustments to their current care. And so this is just meant to give you enough information to make a quick decision whether or not this is somebody you want to follow up with or look up in your medical record system to get additional details on. So you can see on the left-hand side here, we have some of our lab values. So our A1C, we have our biometrics within BMI and their weight. And you can see those are tracked over time. You can hover over each of those data points to get the time frame from that data point. Obviously, you can see the x-axis is a little sparse there. That'll tell you when that was actually from. And then in the middle here, we have our biomarkers, diagnosis, and visit info. You can see that blood pressure and retinopathy for this fictional patient don't have any records, and so that's what will show if they don't have either of those things. But you can see that they do have a diagnosis last documented on August 7th of 2021 for CKD, and that their last visit with a nephrologist was from October of 2021. Along the right-hand side here, you'll see that we have the medication statuses. You can see that there's a little bit of a difficulty distinguishing between active and inactive medications, just simply due to the color coding here. This is something that'll be improved upon greatly within Dashboard 2.0 updates, and so you'll be able to distinguish that a little bit more visually. But you can see, for example, that this patient is currently taking metformin, DPP-4 inhibitor, and a GLP-1 receptor agonist. So general features and functions enhancements. So as I mentioned a little bit ago, we will be including endocrinology attribution with a target date of Q1 of next year. And so that'll complete our 3 different specialty providers for MCT2D within the dashboards. And the next item here would then be the differentiation between Blue Cross Blue Shield Medicare and commercial patients via claim statuses. So for those of you that are currently working on the MCT2D PCP VBR measure, you know that we utilized the age 65 greater than or less than as the proxy measure to distinguish between Medicare and commercial. And so this feature will be coming to do it a little bit more concretely, utilizing actual claim statuses. And then we'll be adding the ability to differentiate between patients that have PDCM coverage, which is the provider delivered care management criteria on their insurance, from patients who do not, which can be a feature to allow you to determine which patients may be eligible to receive that type of care through your practice. And then finally here is identification of the last PCP visit, which will allow you to identify patients who may be overdue for care. All right. Now is my turn to take us a little break, and I'm going to turn it over to Laria to talk through Dashboard 2.0.
Thank you so much, Jake. I'm going to request remote control of your screen.
Yes. If I can find my cursor, I will give it to you.
Perfect. Thank you. Okay, thank you, Jake, so much for the introduction. I'm really excited to get to talk to you about the Patient Data Dashboard 2.0 is what we're calling it. The first sort of phase of this released on September 9th, so it's very new, and we're really excited to hear feedback from you to get people in there using it and letting us know how they've been using it and if it's helpful for you. I wanted to take just a minute to give a little bit of a background on the development of Dashboard 2.0, because incorporating our members' feedback is something that's really, really key to all the work that we do. And so after the first version of the dashboard release, we knew there were opportunities for improvement. Jake even talked through some of them, sort of introducing some aspects of the legacy dashboard, like having two separate tabs for our renal filters, difficulty in downloading reports, and things like that. And so we started by hosting these 30-minute one-on-one interviews with members, both people who had previously used the dashboard and people who hadn't, asking them all sorts of questions about how they would want to use it, how we could improve it to make it a useful tool. We then took all of those interviews and other information we had gathered through our regional meetings and things like that, went through and coded them into different updates and enhancements that we could make, and then started breaking these out into different phases of implementation. And I just wanted to show what an example of how we've been using this data might look. So we created a series of user stories to try to figure out how, again, those dashboard features that we build could be used to enhance quality improvement and care in the collaborative. So this is a PO representative example. This is an actual quote, but with fake names, of someone talking about how they wanted to be able to establish a current baseline of CGM prescribing for their practices, and then be able to really easily download a report that displays each of their practices' current prescribing rates for CGM. And so this is an example, and I'll show an example of this in the new summary measures page that we really wanted to make possible to the whole collaborative. In addition to doing those interviews, we've also really tried to focus on gathering group feedback from multiple people at once. And so if there's any PO representatives in the audience, this might look familiar to you. During our collaborative-wide meeting, we hosted a co-design session where we asked people to start tackling the issue of SDOH data, because we want to make sure we're prepared when we have the ability to build that in, and ask them to design what a health equity and SDOH dashboard would look like for them. We also just recently hosted our first focus group looking at the new summary measures and first release of Dashboard 2.0, which you can see an example of here, getting people's feedback immediately after launch on how useful this was for them and other ways that we could continue improving it. And this is something we want to really continue doing in the future, so you'll probably see some opportunities for this become available. We plan to host another focus group in the winter and then again in the spring to gather feedback on some of the newer features. So just a really quick reminder of how you can access the dashboard, and I know Jake's going to be talking more about this at the end of the presentation. There are two main ways to get there. One is to visit our MCT2D website, and you'll see in the upper right-hand corner a button that says Patient Data Dashboard. You can click that and it will take you through your login process, or you can go directly to the Michigan Data Collaborative website and log in that way. Once you do that, you're going to see a list of the different dashboards that you have access to, and you're going to see two here, one called the Legacy Patient Data Dashboard and one called Patient Data Dashboard 2.0. And I really want to make this clarification that we are working to unify our two dashboards, but as we build out Dashboard 2.0, we've maintained our original dashboards, the ones that Jake was showing screenshots of earlier, and those can all be accessed in the Legacy Patient Dashboard, and we'll have those available to you. So you can go in and explore Dashboard 2.0 and try the new features, but if you want to be able to access those features that you're used to, or maybe that don't exist yet in 2.0, you can always do that by looking for the Legacy Patient Data Dashboard option here. Jake's going to be talking more in detail about how to request an account if you don't already have one for logging into the dashboard, but we also created a set of tutorials that are available on our website, and I'll put the link in the chat once I'm done talking if you want to take a look at these or scan the QR code, and this will help walk you through, once you do have access, how you can log in to the dashboard itself. So again, I just wanted to flag this. If you do log into Dashboard 2.0, you'll see our new landing page, something I'm really excited about. But right now, all the features aren't live on this page yet. You'll be able to access specifically from here the summary measures page that you can see the arrow pointing at on the left-hand side, and the new updated user guide for Dashboard 2.0. And if at any point you want to transition from this new dashboard to our legacy dashboard, there's a button up in the top bar here that you can see with the arrow pointing on the right, and that will take you back to the dashboard that has all of those original features. So I'll go through just briefly some of the new features we've added in this 2.0 release and the ones that will be coming soon. So again, that landing page, one of the things we heard from users was that it was confusing when they first logged into the dashboard. You had to go through an attestation process, and then it immediately dropped you on that patient list page, which had all those filter options, all of the patient lists, and it felt a little jarring for people. So one thing we did for Dashboard 2.0 was removed the need to go through that attestation. So you'll notice that when you log in, you won't have to click that accept button anymore. We also updated our data banner, and this was an important piece of feedback to really show very clearly the last time the data had been updated. We also wanted to improve the way to navigate to different pages. You maybe saw in Jake's screenshots that there were these tabs at the top that are a part of the Tableau design. And that was the only way really to navigate between our pages. So we wanted to make it a lot clearer and a lot more visual, which you can see here. And we also added an FAQ section that we'll continue to update. So if you have questions about, what data is actually being included here, how you can get help, or what to do if you see that data is missing, you can find all that information at the bottom here. The big part of this first initial release of Dashboard 2.0 was an update to our summary measures page. So we basically completely rebuilt this page based on your feedback to give you a really high-level overview of those key diabetes measures. Along with this, we created a set of drill downs. So on each of the visualizations that you can see here, you'll see there's an expand button in the upper right-hand corner. And if you click that, it will open up a panel that allows you to see a drill down of that data. If you are a PO, you can see a comparison of providers and your practices, or your providers if you're a practice level user. We also included in here the MCT2D performance measure, which you can see right at the top around A1C. And per the question in the chat earlier, there is a really big blue button that says download. And when you click that, it takes you to all the download functionality because we knew this was something that people wanted. And this will allow you to export the entire report, including every drill down that you have expanded, as sort of a multi-page printable report. We're going to be adding an enhancement to this soon, and this will be to give you the option to narrow your population that you can see here down to the performance measure population. And if there's any questions about that, let us know. Basically, this is instead of patients that just have an A1C in the last 12 months that fit into these two different age categories, this is going to allow you to see your exact performance population for the A1C measure. And as I mentioned before, as part of this new release, we also created a tutorials page and links to updated user guides and other supportive materials, which you can find on our website at mct2d.org/patient data dashboard. It's also under the About tab in our upper level menu. So for what we're calling 2.1, which is going to be our next phase of design, we're going to be rethinking our old legacy summary measures page. So if you used that before, you may know that it allows you basically to compare different organizations on a variety of measures. And we're going to keep that idea, but really focus on making this a tool to allow you to build different comparisons that you can then download and save as a report. We heard multiple times from the collaborative that having the ability to look at comparisons in a different ways was really, really important. And so we want to make this really easy and helpful to you. So we're working on that development and design right now. In addition, when you log into the new Dashboard 2.0 Summary Measures page, you'll see at the top here a button that says Pre-populated Reports. This was another request we heard that people wanted to have reports that sort of summarize the data on a variety of different topics. And we polled our PO members, and the things that we identified were reports that showed various trends, things like HEDIS measures and prescribing, comparison reports, so having pre-built ones that you can use. Hold on, sorry, my computer screen just went black. There we go. Hopefully you can still hear me. And then also providing detailed practice reports for people who are at a PO level so that you can see a breakdown of, again, those different measures. Then moving on to the 2.2 release, we're calling it. So the phase after that, Jake talked a little bit about this around the patient identification tool. we are going to be really re-envisioning that patient profile page and patient list page. And this is something we're really, really excited about. We heard from members that people even use this as talking tools with patients when they're in an appointment. And so we want to make this as clear and easy to read and really provide that supplement to your EHR. So some new things that we'll be including here are possible overdue care alerts. So we know that our data is not perfect, but if we are getting regular data from you, we want to let you know if there's a patient who's maybe overdue for something like a retinopathy screen. And we also really wanted to improve the layout and design of things like the biometrics labs and those active versus inactive prescriptions, which you can see in the mock-up here at the bottom. Going to that patient list page, trying to simplify that. As Jake said, we have all those filter panels. We've had to split it into 2 different pages now where we have the renal details option. We want to combine and bring those together and really simplify the view for this. Also bring in the idea of overdue care alerts to this page so you can see them on the higher level without having to go into the patient profile. And just really thinking about how to streamline this page. In addition, we want to add follow-up care lists. So this will be an option you'll be seeing in the future. We want to give you pre-filtered patient lists. So instead of you having to go in and make decisions and put those filters in, we want to provide you with lists based on key measures that we think that you will find helpful. So again, things like patients with an elevated A1C that you can easily download, patients who have that possible overdue retinopathy screen, and things like that. In addition, and Joyce Lee has really been a champion of this, we know we're going to get that social determinants of health data, and we want to be prepared and think really critically about how we display this and how we make it as actionable as possible to you. So this is something that we're working through, hopefully for release in 2025. And Jake, I'll turn it back to you.
All right. Sorry about that. I was trying to get the cursor to let me control things. All right. All right, cool. You can hear me. All right. So for the last part of our talk today, we're going to talk a little bit about some of the data quality work that's going on. And this will be pretty brief. And just to be clear, a lot of this work isn't really going to be at the level of the practice. A lot of it is going to be working between MCT2D, the Michigan Data Collaborative, and the POs as a larger entity. So, for example, one of the challenges that we have is completeness of lab reporting. So this can come from a couple of different possible avenues. So, for example, when a physician organization is reporting, let's say, serum creatinine, one of the challenges that we have is that there's a number of different link codes and CPT codes, which are the identifying codes that are sent along with the lab values to the Michigan Health Information Network. MCT2D doesn't always have clear, concise dictionaries of which codes are used for that. And different physician organizations use different codes. And so this is work that is continuing to be completed between the Michigan Data Collaborative, the Michigan Health Information Network, MCTTD, and the POs to try to streamline some of the codes that are utilized for different labs and making sure that we're capturing all of the codes that are being used by the various different participating physician organizations to make sure that we are capturing a complete and total lab picture. Another possible area that, or an area of complication that we've encountered is practice identification. So one of the things that is very important, obviously, is that we're able to identify which practices are the data is coming from when it's being sent from an overarching PO. And so the PO ID and the practice unit ID are 2 numbers that are utilized within the PPQC architecture, and that's not something that is required to be populated. And so this is something that conversations are continuing and ongoing to make sure that we're able to utilize those different fields to effectively identify which practice a specific patient is attributed to without having to backtrace a practice to a physician to a patient through the PO ACRES files or through the Blue Care Network attribution files. We know that a lot of the data that is currently being sent to MyHIN from the physician organizations is the fields that are required to be submitted for other quality improvement initiatives such as HEDIS. Those values include things like A1C and some kidney labs associated with the current HEDIS measures. Outside of that, we know that there's operational difficulties for adding additional data fields to be sent. And so one of the things that we have talked about is the possibility of including some form of incentivization structure for additional data fields, recognizing that there is an administrative and technical burden on the physician organizations to send in additional data fields that may not already be required for current measures. And so with that, the last challenge that we're really focusing on right now is units on different biometric information, specifically weight. So one of the things that we've run into is that we have different physician organizations reporting weight in either pounds or kilograms, and sometimes even in ounces or in grams. And we don't have units associated with that, so we can't tell if this is something that is an accurate value or a value that is erroneous, or just that it is in kilograms instead of pounds. And that obviously makes comparing different practices or different physician organizations very difficult. It also makes it difficult when units change within the same patient and we're seeing extreme fluctuations in weight. We know that we have some values, just to give you an example, of weight in the hundreds of thousands. And so it's difficult to know when there's 40 or 50 values in the hundreds of thousands, if that's because it's in grams, or which of those may be a simple error without having a decimal place where it should have been. And so the work that's being done on this really is more so between MCT2D, MDC, and the physician organizations, and more work will be done in the future. But as dashboard users, which the majority of you attending today's call are, there's a couple of things that you can do. So if you're looking at your access level within the patient data dashboard and you notice something that's either missing or that's incorrect, it is incredibly helpful if you reach out to MCT2D and let us know, saying, hey, I saw this value for this patient and I don't have that value anywhere in my medical record. Oftentimes we know that our data is not going to be as up to date as the data that you have in a medical record. As we mentioned, we do have that data lag time. So that is to be expected. But if you're noticing something that is simply not correct, or if you're noticing that a patient, for example, is missing a ton of A1C values from over 3 months ago, and their last A1C came through like a year and a half ago, but you see those A1Cs just from a couple of months ago in your medical record system, let us know, because we can use that as a back trace to try to identify where there may be some issues or something's getting held up and not making it all the way through that data flow. And then obviously any support that you can show with regards to the patient data dashboard to either your physician organization or by participating in additional focus groups that LARIA holds as the additional features and functions of Dashboard 2.0 are launched is incredibly beneficial to us. Like I say, we're not designing this in a vacuum. We're designing this to be useful to you as the end user. And so if you do have feedback on that or are willing to participate in a focus group like that, that would be incredibly beneficial to us and hopefully to you as well. And then finally, just suggesting ways that we can improve even outside of those focus group environments. And so that includes saying, hey, I thought about this one use case and thought it may be a useful thing to add to the dashboard, or just shooting that to us in an email. That kind of thing is incredibly helpful. We add that to a log of future enhancements and work to prioritize that along with the additional features and functions we're currently trying to implement. All right. So data quality enhancements. So as I mentioned earlier, endocrinologist attribution will be going in Q1. So that's kind of both a feature and a quality enhancement. We are working to reduce claims and clinical data lag times. That's a priority for, oops, I did not update the years on those two middle ones. I apologize. Those should be 2025. Q1 and Q4 of Q1 through Q2 of 2025, excuse me, for the reducing of the clinical and claims data lag times. And so right now, as I mentioned earlier, we're sitting at about 2 to 3 months at the initial update. And so we're hoping to get that down into the sub 2-month range and then continue to improve over time. MDC recently completed a lean event to identify every single aspect of that data flow and to look for areas that efficiencies could be gained. And so that work will continue. It's never going to be done. We're just trying to improve steadily over time. And then, as I mentioned, that PDCM eligibility, again, really focusing on this as a potential ability for the clinic to identify patients for which they may be able to provide PDCM care for. And then again, incorporating that weight unit of measure, for example, so that we're making sure that we can differentiate between either a unit issue or an actual erroneous value issue. All right, so for the last little bit here, just a couple of slides to go, we're going to talk a little bit about how to get access to the dashboard in a little bit more detail. So the picture you're seeing right now, just to differentiate, is our administrative portal. So this is a separate system from the patient data dashboard. MCT2D has 3 web-based presences, just to kind of level set for folks. We have our website, which is mct2d.org. And we have the patient data dashboard, which is what we've been talking about today. And we have our administrative portal. The administrative portal has no patient information in it. It is focused either at the PO level users or practice level users who have requested access. It's not required to have access to the PO or to the administrative dashboard if you're not a PO level user. However, if you're a practice level user and would like to be able to have access to the administrative portal, you're welcome to. We post and have all of the different VBR requirements in there, and you can track your practice's progress on that. But under the PO resources tab on the left-hand nav bar there, you can see that we have a MDC user access request tile here. And so if you click on that, you're able to download the access request form. If you do not have access to the admin portal and have no desire to have access to the admin portal, please just email MCT2D or myself directly, and we will send you the access form. So the steps necessary to get access is to complete that access request form. So a picture of that's here. Just requires your organizational name, whether or not you need PO or practice level access, and then some personal information about you. Notice that there's some red asterisks there for the required information, and then the last 4 columns are not required. After that form is complete, your PO acknowledger, who every PO will have at least one PO acknowledger, is the individual that will need to send that completed form into the Michigan Data Collaborative. That Michigan Data Collaborative email address is here on these slides. That's mdc-accounts@med.umich.edu. Just attach that form and say, hey, I would like to get this person added as a patient data dashboard user for the Michigan Collaborative for Type 2 Diabetes. And then MDC will be able to take it from there and get that individual set up with a username, and we'll be following up with them with the appropriate links to get them to be able to log in. If you do not know, for example, who your PO level acknowledger is, or for example, don't know who your PO clinical champion is, because they'll know who your PO level acknowledger is, feel free to reach out to MCT2D and we can let you know who that individual is. All right. So with that, we have reached the end of our slides. We have about 13 minutes before the top of the hour for any questions. We'll hang out for a bit, and please just feel free to unmute and let us know what questions you have. And Laura did put a link in the chat to our tutorials webpage so that you guys are able to access that as well. Dr. Lee, anything that you wanted to just add or that we missed?
No, I think you guys were super comprehensive.
Good.
I do think Tableau is like, sometimes it's not totally intuitive.
Mhm.
So I think it is important to reach out for help where we can, because I think it will make your experience with it better, just because it takes time. That's all I wanted to
Yeah.
say.
Yeah, and to that point, if you guys do want to do either one-on-one sessions or like a practice level training session where we can kind of get into your specific instance of the dashboard and really poke around and play around with it together, absolutely love doing those. Feel free to shoot me an email and we'll get something scheduled. We'll hang out for a little bit in case anybody has anything bubbled to the surface. If you don't have any questions, feel free to sign off and take 10 minutes back. Thanks, Mary. Hey, Sarah, I saw you come on video. Did you have a question? Oh, No worries at all. Just wanted to make sure. All right. Well, hearing none, I think we can go ahead and, one question here. Will you guys be sending? Yes, absolutely, Michael. So we'll be following up with the email right after this with the sign-in sheet. And here, I could put it in the chat here for you again if you'd like, if that's helpful for you. So you can get a jump start on that. But Lefa will be sending out an email following this with the sign-in sheet and the slides. You as well.
Thank you again, Jake.
Yeah, thank you. All right, we'll go ahead and close out the meeting. Thanks, everyone. Have a great weekend.